Three, two, one, go.
Okay, so as we move along here, we're going to talk a little bit about something called the Kendrick's extrication device, or the KED. The KED is a device that we're going to use to extricate a patient from confined space. And it's a tool that we're going to use when we suspect that there is a possible neck or spine injury, and we're trying to maintain spinal motion restriction on this patient without causing any further possible paralysis or injury to the patient. And sometimes it's going to happen when we simply just cannot get a backboard to the patient, or they're in such a conspicuous place where normal conventional methods of removing the patient on and just placing them to a spine board is just not practical. So in that case, what we'll need to do is we'll use this tool to be able to help us move this patient to protect their C-spine. So in this scenario, my assistant's going to help me with moving a patient, and what would be, we've kind of set up a makeshift car, if you would picture these four chairs as the seats, the front seat and the back seat. And this particular scenario, this patient was involved in a serious multi-vehicle collision, an MVC, and there was significant damage to the vehicle, and we had to use various different tools to remove the vehicle from around the patient. The patient was entrapped and pinned in the vehicle, and so we may not be able to use a traditional method of just using a backboard to get them out. We might actually have to use our KED to remove them safely from the vehicle and with minimizing injury to the spine. So the KED, they all come in this green package. I will be honest, most of the time we don't use it in the pre-hospital environment because it's kind of cumbersome and not too many people know how to use it. So you'll find this in the ambulance tucked away in a corner with about 25 years of dust on it, so it might look a little less green when you find it. Nonetheless, when you take it out of the package, you'll notice that it kind of comes like this. There's this cushion right here, and there's some straps for the head, and then there are 5 straps. So on these straps are actually on the outside portion of the KED. The KED is kind of like a sweater or a jacket that goes around the patient, okay? You've got 2 white straps. These white straps go up underneath the patient's leg, and then you've got a red, a yellow, and a green strap, and they connect to, on the other side, a red, a yellow, and a green buckle. You've got a handle on this side, a handle on this side, and then you've also got a handle at the top as well. I've actually used this particular thing in the civilian world as well as an Army medic. I had to extricate some folks from a tank, and after getting them secured, I actually used this to help get them through the hatch of the tank, and it worked very well. Okay, so when we actually do this particular thing, this cushion, can also be used to fill in a gap. Sometimes we can fold it over or put it directly behind the patient's head when we secure them to this, to kind of fill any gaps between the head and the KED. I'll show you that here in just a second. Setup is the key. So when we set this up, we want to make sure that our stretcher is ready to go, our long spine board is ready to go, so that way once we get the patient secured on the Kendrick's extrication device, the KED, we can actually remove them out of the vehicle or wherever they're at onto our stretcher. We don't want to have to get them on here and then have somebody set the stretcher up and get things ready to go. All that needs to happen before we begin this process. And a lot of this is a dynamic process, and it's happening fluidly. Okay, so there's a top and the bottom. The straps go on the bottom part around the patient's waist, and then this part, it goes on top around the patient's head. In this case, Cicely's already in the back. She would have her BSI on, and she would have all her protective equipment on in the back of this vehicle, and she's got a cervical collar on the patient and maintaining manual C-spine. What we're going to do here is I'm going to actually slide this. So I'm going to slide this behind the patient, and she is going to lean the patient forward, and on her count, we're going to lean the patient forward, and I'm going to slide this behind the patient.
Okay, ready? 1, 2, 3.
Okay, so now what I'm going to do here is I'm just gonna work right around her, and she's gonna have to move a little bit. You're gonna have to work with your partner because she's trying to maintain C-spine while you're getting this device in. So once we get the KED down, then what we're gonna do is she's gonna maintain that manual C-spine of the neck, and I still have these 2 straps. So I usually just take one strap and put it over the shoulder just to keep track of where it's at, and then I'm gonna take the other strap and that's gonna come around. You're gonna reach around the car. Now, mind you, a lot of times this is a very precarious situation you're putting yourself in. You're gonna be in some weird positions sometimes. You're just gonna have to work with it. Let me see where my strap at. Make sure my strap actually went around the patient, which it did. So this strap is gonna come up and in between the legs. Now with this strap, understand you wanna try to do your best to not pinch your patient for obvious reasons, right? That's painful. All right, and then we've got the white buckle behind here, and then we're going to secure this white buckle to the white strap, and then make sure you don't get your patient's arm in there. And then secure this down. Now, when you secure these, you're gonna just secure them snug initially. You're gonna retighten them here in just a minute, okay? So now I'm gonna take this other strap, and this other strap's gonna come around and underneath the leg here, and then it's gonna come up high and tight, trying not to injure or squish the patient. And again, secure to the white buckle on the other side. Just nice and snug. And then what we're gonna do is we're going to put this part of the KED underneath the patient's arms like so, and the same for on this side. Okay? And then what we're gonna do is we're going to secure the straps. I know, right? Normally your patient's arms are kind of pliable and you can just work around them, but old Harry here is a little rigid. His arm, that's a trauma, for sure. For sure. So the ideal here is to secure these straps in such a way where they're going to hold your patient, but you don't want them to be so tight where your patient cannot breathe, okay?
Don't make their arm fall off.
And try not to make their arm fall off in the process. Okay, so now we've got these white straps that are the head and chin strap. So every now and then, if you have like a gap between the patient's head and the back of the KED, you can actually put this down back between that like so, and either fold it over, or you can kind of fold it down like this and place that behind the patient's head like so, and then secure it to the KED. If you don't have much of a gap there, then you don't need to use this. You can just keep that in the container right there, in the bag that it came in. And then what we'll do here is we're just going to secure the patient's chin. These things are Velcro. These things are Velcro right here. And so they're going to go up underneath the chin, and there's like Velcro strips right here that you're going to secure this to, just like so. Kind of make like a little X pattern there.
There we go.
Now, one last thing what we're going to do. So the idea behind these straps is it actually needs to be tight enough that it pulls the patient's legs up and retracts the legs up. So that way it puts the patient in a nice seated position. And then you can actually it helps you get the patient out. So you're going to pull these really tightly, all right, really tight, and then you'll notice it'll kind of frog the patient. The patient will almost like both legs will kind of go like this. It'll kind of like go up like this, and it's going to be hard for them to be able to move their legs. And so that's okay. We want to do that, and then just give these a little bit snug tight, not too tight, but just enough. And now we're ready to actually extricate the patient out of the vehicle. And so, Maintaining C-spine is important, even up to this point. So at this point, she technically can let go of C-spine, but for us to help get the patient out of the vehicle, she is going to help maintain that just control over the head as we move the patient out of the vehicle. Now, you might have to sometimes position the patient to go that way in the vehicle and then go legs out first. Sometimes you might have to go head first and legs into the vehicle. It just depends on how the damage is of the vehicle or how the configuration is of the confined space on how you're going to get the patient out from this point on. Okay? All right, so let's get the patient out and put them on the backboard, and I'll show you what we need to do from there. So here we go. We're going to get this close. All right, and then we're going to carefully, on the count of 3, on your count.
Okay, 1, 2, 3.
Okay, and on your count. Ready?
1, 2, 3.
So now at this point in time, normally the legs, but this is a mannequin, would be kind of like this. And it would be kind of a clue that maybe I should loosen those straps, right? So I'm going to loosen the white straps a little bit. And then, did the light fall off again? Okay, and now we can secure our patient properly to the backboard.